Hi, let's talk a bit about diets that can help you reverse your type 2 diabetes. Now, there are several ways that people have achieved this in the past, and I'm going to start with the least desirable way of doing this, and that is bariatric surgery. So bariatric surgery is a collective term for weight loss surgery. So that could be anything from an adjustable gastric band that they fit around your stomach to make you feel less hungry. It could be sleeve gastrectomy, where they actually remove a part of your stomach and turn it into more of a tube-like structure so that you can't fit so much food in there. Or it can be a gastric bypass, where they give your stomach and the small intestine a total makeover basically, and they just make it very, very small. So it fits about 30 milliliters or something like that, which isn't a lot of fluid. So that means that you can barely eat or drink anything at all without feeling completely full. Unfortunately, this also leads to less absorption of nutrients and the foods that you eat. Literally, when you can't eat a lot, you will get malabsorption of the foods, and eventually you will get deficient in a lot of different nutrients. So you will have to be on a lifelong supplementation of vitamins and minerals to get enough of those, because there is no way that you'll be able to do that with food. So maybe you're thinking like, one or two of these options don't sound too bad after all. After all I have to do is go in, get an operation, and then I'm done with it. It doesn't require any effort on your part. But I want to warn you. So first of all, it's really expensive. If you get it paid for someone else, I still want you to think about whether you want to do this, because it's a lot worse than that. People have died doing this procedure and other procedures as well. Every time you go under anesthesia, your life is at risk. But there are many complications that can come from such surgery, so I want you to think about it not twice, but maybe 10 times if you're even considering it. Other common side effects are bowel leakage. Just imagine that does not sound pleasant to me. Bleeding, ulcers, kidney and gallstones. You can get food intolerances that you've never had before. They just appear out of the blue. And as I said, you need to take your supplements every day, literally, and a lot of them to stay somewhat healthy. Hormone imbalances, that's a big one as well. Probably due to the malabsorption, but yeah, especially the low fat in my opinion. There's also a thing called dumping symptoms. So that means that you might not even be able to eat almost hardly any sugar or fat, which might be the two things that you live for right now. I don't know, but those are the things that most people find very palatable, especially in combination with each other. Just think cheesecake and donuts, etc. Or pizza. All of those things, most people like them, and you won't be able to even have a small bit of that without your stomach being really upset. And that can be diarrhea, which some people think, well, I'll pay that price, but it can also be causing you some proper blood pressure issues, and usually leading to fainting or just lightheadedness. And I have had that most of my life because I have hereditary low blood pressure. So I'm not too bad now at an adult age, but it was worse when I was young, and that's not fun to deal with. And if you have that pretty much every time you're eating, and with a 30 milliliter stomach, you're gonna have to eat pretty much all the time and keep that one full so that you get some sort of nutrition in. So it's also common with hair loss, so I wouldn't really recommend you to do this. I think we can sort of agree that this isn't necessarily the best way of dealing with diabetes unless you are very, very desperate. But I do beg you to look at alternatives for how to deal with your type 2 diabetes. Because to me, it sounds like your life might be a lot more miserable after the operation than it is right now. So when it comes to health, you're definitely not going to be better off. If you only have type 2 diabetes, you are in control and you can actually do something about it. That's the good news. So let's have a look at the second option, and that would be a low-calorie, low-fat diet. So this way you are decreasing the total load on your whole system. You are taking in less calories, you're taking in less sugar, you're taking in less of everything because you're eating less. So it will work at some point. And you will be able to keep your blood sugar lower, perfect, and it will give your pancreas and your liver possibility to start repairing and do what they are meant to do. So this could work, but there are many reasons why I do not recommend this diet to anyone. Some of the most important ones are that when you go on a low or chronically low calorie diet, what you do is that you are dialing down your basal metabolic rate, which is the amount of energy you burn without doing anything on any given day when you're just sitting still or actually in coma, but the amount of energy you need to survive. So if that one is, let's say, 1100 calories right now, if you go on a chronically low calorie diet and low fat diet, let's say you're just eating 1100 calories per day, your body's gonna be like, what's going on here? This is not good news. We're burning exactly as much as we have. We never have anything spare. This is dangerous. This is threatening our survival. What we're going to do is that we're going to pull back. We're not going to use as much energy. Your basal metabolic rate will go down to maybe 800, so that there will be some energy left for you to do other things like walking, exercise, etc. But you might be very cold, you might get very tired, you might get dry skin. All of these things that are signs of a lower metabolic rate and a thyroid problem. You might start losing your hair. So I don't like it. I like to eat, and I think most people I know anyway like to eat, and I think it's better if we can eat a decent amount of real good food. The second reason is that low fat is never a good idea. So we need fat for all the cells in our bodies. Fat is incorporated into all your cell membranes. You can't build cells in your bodies without fat. And your brain and your nervous system are mostly fat. If you have any sort of brain fog, any nerve damage, I know many diabetics have neuropathy, which is like maybe it starts with tingling in your fingers, maybe in your toes, you stop feeling things in your fingers or toes, etc. That is neuropathy. And if you want to heal your nerves or your whole nervous system and reverse the neuropathy, you need fats. You can't be on a low carb diet. It's not going to work. And something else is that a lot of hormones are based on fat and cholesterol. If we don't have that, we're not going to have the capacity to make as much hormones that we need. And one of the bigger ones is sex hormones. So for you guys, I know every guy on earth, they want to keep their testosterone high throughout life if they can. It's not going to happen on a low fat diet and a low fat, low calorie diet. Forget about it. You need the fat to do that. And women, especially if you're reaching perimenopause or menopause, hot flashes, get your fats in. And same thing, irregular periods, get your fats in. Your body needs the fat to get the signal that everything is functioning as it should, there is nutrition, and we're happy to keep going and be fertile. It's not going to happen when you kind of dial back, because that is an emergency situation. That's not a situation where you would want to make a baby, etc. So, and the last reason I just thought I would bring this up, have you ever seen these, I say older people, but they're not necessarily always that old. They might be 40s, 50s, 60s, unfortunately, and they look like they're in the 80s, skin-wise. It's like the skin, it's like the skin and bone, and the skin is just dry and wrinkly, and it's kind of like papyrus paper. It looks not very nice, if I might be a bit judgmental. That's what you get when you're not having enough fat or protein in your diet. So in the in defense of the just low calorie, these people are usually deficient in proteins, which means that they're most likely vegan or vegetarian. So if you don't want your skin to look like that, I prefer to have my skin being like plump and fresh looking, then get your fats in as well. Okay, that was a little bit off topic. So yes, this approach works if you just worried about reversing your diabetes, but I wouldn't recommend it to anyone because it messes up so many other areas of your life. So the last diet that has successfully been used to reverse diabetes is a low carbohydrate diet, and I think more specifically a ketogenic diet, but that just means a very low carb diet. And I know that this scares some people because their diets are very high in carbs, but you can retrain your body to run on fats rather than carbs. It might not feel like it right now, but everyone can do that. You have the machinery to do that. It's in your biology. You are made to be able to use fats for fuel. And this is necessary if you want to reverse diabetes and still have some sort of energy throughout the day. Okay? I know that some of you might be thinking that it's easier to eat everything in moderation because you can't live without bread, chips, pasta, whatever it might be. Donuts. Believe me, you can if you want to. Not everyone wants to give up on those sort of foods, and in that case, this is probably the wrong YouTube channel for you, because I want to help people who actually want the help and who wants to reverse their diabetes with a low carb diet. So all you need to do is give your body a chance to readjust to your new diet. It doesn't really, well, it can take quite a long time before it gets totally adjusted, but to get adjusted to a level where you feel better than you probably do right now is usually pretty quick. Are there downsides to a low carb diet? Other than being a bit unsociable, I personally don't think there is. There's nothing strange with eating a low carb diet. That's what we're made for. It's just our society has decided that that's not a balanced diet, which is BS in my opinion. So in terms of health, there are only benefits from a low carb diet. If you are on a blood glucose lowering medication, you will need to speak to your doctor and adjust the dose if you're going to start cutting all the carbs all of a sudden, because otherwise you might get too low, and that's very unpleasant as well. So please don't do that. Make sure that you adjust your medications before you start. Having said that, when you first start, there might be some issues for some people, and especially if you're coming from a high carb diet. So you might experience some gastrointestinal discomfort, you might have headaches, you might feel fatigued in the beginning while you stop eating the carbs, but your body doesn't really know how to use the fats for fuel yet, so that needs time to readjust. Once you pass this though, you're gonna notice a few things, and this is the most amazing thing. I remember the very first time I went keto and I was like, wow, what is actually happening? So first of all, your blood sugars are going to be a lot more stable and probably lower straight away. For some people, they're going to remain high when you have a lot of insulin resistance, and if you have been type 2 diabetic for a long time, they might remain quite high. Maybe that high is still lower than it used to be, but maybe it's elevated. But the thing is that it's not going to go up and down all the time. It's going to be quite stable. So you're always going to know what's happening, which is quite comforting actually. You will start waking up with a lot more energy and feel like you actually had a good night's rest. And when it comes to sleep, you most likely, once your insulin is going down, when you don't need that insulin for all the carbs that you're eating, you're most likely gonna, if you are one of these people that go up for a wee once or twice every night, you're probably gonna sleep throughout the night, and that's gonna be pretty amazing. Usually any bloating that people have before they go low carb is going away, and that could include other things like acid reflux, and yeah, even if you're taking, unless you're taking like metformin for example, which is notoriously known for causing GI upset, If it's diet related, it will go away. If you take metformin, it's probably not going to go away because you're still taking metformin, okay? You will also probably notice how your mood improves, like anxiety is going down, you just feel more relaxed and happy with being and doing what you're doing, and you will probably be more pleasant to be around. And one thing I really enjoy is that you won't be hungry 24/7. It's like the hunger disappears and you're satisfied after eating 3 main meals, or even 2. I'm usually eating 2 nowadays, but even if you eat 3, you're gonna be happy with that. And my mom used to tell me years ago that you're constantly eating, you're just eating all the time. I was like, yeah, I'm exercising a lot, I need to eat 6 times per day. And to me now, it's crazy how they recommend that, because that is messing up your metabolism and messing with your insulin and your insulin resistance. So try to cut it down, try to not do any snacking, and stick to your 3 main meals per day. If you have any like skin tags, brown patches in your armpits or maybe your groin, etc., you get like dark shin spots or infections, sores, wounds that won't really heal, especially on your feet. All those things will start going away, because when you go low carb, the inflammation in your body is going down as well. So it's the inflammation, and it's the lowering in the blood sugar, and it's the lowering of the insulin. All of those come together and magic happens. Things just start going away, which is quite amazing. And eventually, if you stick with a diet, so if you go and test your HbA1c, you have a number, you start doing a low carb diet, you test again after 3 months, I bet you it's going to be lower. Even if you have a blood sugar that is really stubborn and doesn't want to go down to pre-diabetic levels. So in my opinion, there is a clear winner here, and the only diet that actually makes sense for a diabetic in terms of adequate nutrition and getting the job done with giving you sustainable energy, keeping your insulin low, keeping your blood sugar low, that's a low carb diet. So if you want to learn more about diet or how to stick to a low carb diet, you can join our Facebook group. And I would also encourage you to press the subscribe button on this channel, give this video a thumbs up so that we can reach more people and help more people. So until next time, have a good day.